4 of the 6 major programs run by the Centers for Medicare and Medicaid Services saw their improper payment rate increase in fiscal 2025. Medicare Part C, Medicare Part D, and Medicaid all saw upticks in how much money went out the door that shouldn't have. While not all improper payments are considered fraud, CMS is planning an all-out effort to rein in fraud specifically and improper payments more broadly. For more on how CMS will take on this systemic challenge, Federal News Network's executive editor, Jason Miller, joins me now. Jason, great to have you.
Thanks, Terry.
Improper payments have been a perennial issue for CMS. So how much worse did it really get in 2025?
The good news is none of the rates skyrocketed, right? None went off the charts. None were like, oh my goodness, like maybe what we saw during the pandemic. But several increased both in overall percentage and in total dollars. And I'll give you some data. CMS says Medicare Part C estimated proper payment rate was 6.09%, about $23.67 billion. That's up from 2024 when it was 5.6%, about $19 billion. So about a $4 billion increase for Medicare Part C. CMS says Medicare Part D estimated improper payment rate was about 4%, $4.23 billion. Now that's up from 2024 again, 3.7% in 2024, $3.58 billion. So again, about a $450 million increase. And then finally, CMS says Medicaid's estimated improper payment rate, and it's very complicated the way they do this, but their improper payment rate for 2025 was about 6.12%, about $37.4 billion. That's up from just over 5% in 2024 and $31 billion, so about a $6 billion increase. Now, again, Terry, let's be clear here. Not all of this is fraud or abuse. Sometimes improper payments are just because of paperwork problems. For example, CMS says in the 2025 Medicaid improper payments, more than 77% was the result of insufficient documentation. CMS actually says this is not indicative of fraud or abuse. Part C also improper payments attributed to situations where the Medicare Advantage organization supporting documentation failed to substantiate the diagnosis of the data submitted for payment. So again, paperwork problems. Now, and Terry, let's also be clear, it's not all bad news, right? CMS says its Medicare fee-for-service organization saw their improper payment rate drop 6.55%, about $28.8 billion in 2025, down from 7.6%, almost $32 billion in 2024. And in fact, the 2025 estimate marks the 9th consecutive year that the figure has been below the 10% threshold, which is a really significant accomplishment.
CMS has been working on this for a long time. Are they doing anything new or different this year to try to address the improper payment problem?
They are taking much more aggressive new steps, and some of it is technology, and some of it obviously is regulatory. In fact, CMS released a request for information back at the end of February 27th, asking for feedback from the public on what they call potential regulatory changes that could include a future proposed rule, other programmatic changes, really to make CMS more effective in what they call crushing fraud to protect taxpayer dollars. Now, they laid out 7 questions. They want feedback around, and they want to say, okay, how could we use better existing statutory authorities to prevent bad actors from engaging in fraud, waste, and abuse? They asked, what could CMS and its contractors do today to make existing processes better to effectively deter fraud, waste, and abuse and promote payment accuracy? Now, feedback is due by March 30th. CMS has already received 68 comments. And Terry, we'll have a link to that RFI on federalnewsnetwork.com to make it easy to find. Now, at the same time, CMS is applying technology. No surprise, artificial intelligence is a big thing to go after waste, fraud, and abuse. Kim Brandt is CMS's Chief Operating Officer and Deputy Administrator. She says at the recent GovExec Tech Priorities event that fighting fraud and abuse is actually her number one priority.
One of our biggest problems is making sure that we catch people who are going to be potentially bad actors and stop them from actually getting a number so that they can start billing the programs. If we can stop them from coming in, or at least identify that they're high risk on the front end, it's a greater chance that we can then either kick them out more quickly or keep them from defrauding us. So one of the cool things we've been using is a Netflix type algorithm, which basically we put all of the information about all the people that we've taken administrative actions against into, and then as as new applicants come in, it runs that information against everything that we already know about the people who have already had bad acts. So we can take those characteristics and then be able to identify, particularly for things like durable medical equipment, home health, and hospice, which are three of the areas that we're seeing the most fraud in, we can then take it and determine that those people are high risk.
Now, just because they're put on this risk list doesn't mean that, or they determine they're high risk, doesn't mean they're kicked out of the program. They're actually put on a watch list. And then what CMS does is more enhanced site visits. They do more data analysis, watch their billing for possible fraud. And in fact, this tool has been very effective, Brant says. Looking just in the area of hospice care, for an example, CMS kicked out over 60% of the companies within 6 months when they realized, okay, there was a risk of fraud. And then they kicked out another 30% within the first year when they, again, tried to get back on the CMS's rolls, try to commit fraud. They kicked them out. So within a year, CMS was able to get rid of 90% of these potential bad actors.
That's a pretty strong performance. Are they applying AI tools in other ways in their battle against improper payments?
Oh, there's so many ways we could go through. Brant offered two other examples that we'll highlight here. One is focused on billing and claims analysis. She says CMS has a quote-unquote war room running this fraud effort.
We are actually able to look at the claims as they come in at the max, at the Medicare administrative contractors, not waiting until after we paid them. This is before they go through the claims floor, and identify issues. And as a result of that, the team has been able to save $2 billion just since March of last year. So again, our hope is that in this next year, as we implement that even more widely, it's going to be a huge saver for us. The fact of the matter is, last year we almost doubled our total savings in terms of program integrity, just thanks to some of these developments, because we were able to stop people from billing very quickly so that we had less bleed on the back end, but also because we were able to really use it to make smarter choices about how to go after these people and then actually stop them from taking the money from the program.
Terry, I'm sure you've heard this before. This idea of pay and chase is always much harder than stopping the payment up front. A good example of not having to do pay and chase, but actually stopping it before it goes out the door. A third tool is called Claw, which Brant says is a contracts analysis wizard.
We put all of our CMS contracts, loaded them into Claw, and then as we have new contracts, you run them against the tool, and then it tells us, all right, based on historical contracts of this type or of this nature, here's what the cost should be. Here's what you should think about. Here's the type of contract vehicle. Should it be time and materials? Should it be fixed? It really gives us the ability to use historical knowledge to be able to then make smart financial decisions about how we move forward on the contracts. The team has only been using this for a few months now, but it's already been extremely effective. They think it's saved us maybe the better part of several $100 million already. I don't have an exact number, but the fact is it's a really neat way for us to be able to use technology to help us make smarter choices and hopefully be able to negotiate better rates and get better overall terms.
Now, Brant says CMS developed Claw tool in-house with the help of a contractor. So something that's a little bit of a change there as well, is that some of this is happening internally, not just they're buying it from the outside.
They really seem to be leaning heavily into AI for improper payments. Are they using it in other mission areas?
They are using it across the board, it seems like. In fact, CMS almost doubled the number of their AI use cases they're working on or they're actually using. In the Department of Health and Human Services updated AI use case inventory from January, CMS says it has 72 use cases. Now that's up from 43 in the 2024 inventory. Now, not all of them are in production, and many could be pretty basic, like a help desk assistant or a CMS chat that drafts emails and other responses to really improve employee productivity. But Brant says a big part of this move to AI is to hire more employees with specific technology skill sets like software engineers. She says a year ago, CMS only had about 13 software engineers on staff, but they had more than 36,000 IT contractors. That's a 6-to-1 ratio of contractors to CMS IT staff.
What we realized was for a lot of the things that Dr. Oz wanted to do in terms of moving forward with the tech ecosystem and things like that, we really needed to have more in-house talent to really be able to have us. So we've been working very closely with Amy Gleason from the U.S. Doge Digital Services, and Amy has helped us really start to build out a really impressive team of engineers and tech experts and people like that, some of whom are coming from the digital services over to CMS on like details, and some of which we are hiring. In fact, if you look at usajobs.gov, you will see that there are tons of CMS tech jobs. We're working with the tech force. We're working with lots of other partners. We are looking to hire a few dozen engineers, actually, to come in-house to CMS.
Now, currently, Brand says CMS, of course, is not going to replace all their contractors, but they have to have more talent on staff to develop and maintain these new and current capabilities. And they've had some success. The number of software engineers is up to about 40 across CMS. So it's up from 13 over the last year. And they want to add maybe 20 more to get to a total of about 60.
Sounds like they're making great progress. A lot to watch here.
Absolutely. And I think this is just a great microcosm of other agencies and how they're starting to think about and apply AI tools.
That's Federal News Network's executive editor, Jason Miller. Jason, thanks for joining me.
Always a pleasure, Terry.
You can find his story at federalnewsnetwork.com.